Hey y'all, let's continue our series on the shit no one warned you about, postpartum edition. Next up, your new inside out asshole. Really fun, right? I'm Dr. Haggerty with Fourth Trimester Doc, and we are here to talk about all things fourth trimester that nobody warns you about. So, this new inside out asshole. Real awesome. I usually see it get a little bit worse around 1 week or so postpartum. What causes it? Of course, the pressure on the pelvic floor from the pregnancy itself, and then also pushing and during the birth. And then if you also have constipation either during the pregnancy or postpartum, this will also cause you to have more risk of developing hemorrhoids. So what do we do about it? There's three things we want to focus in on. The first is that we work to keep our stool soft and that we go to the bathroom every single day. So the things that we want to do that are taking things like magnesium, drinking 2 warm glasses, like lukewarm glasses of water every morning. It can help with sort of starting the digestive system and getting things moving every morning. It's an Ayurvedic technique. Not cold, not hot, just sort of lukewarm. And then continue to take the stool softeners that you got in the hospital, especially if you're taking opioid-based pain medication. Sorry if you're hearing the train in the background there. So the next thing we want to do is focus in on making sure that that you're in a good positioning when you're having bowel movement. So you want to use, for example, like a squatty potty or some sort of like a stack of books or boxes or something where you're putting your legs up so that your knees are above your hips, so that you're able to relax your pelvic floor when you're having a bowel movement. We don't want any straining to be happening. The other thing that you can do is you can also work with pelvic floor physical therapists to help with, they use things like biofeedback, for example, that helps with being able to release that pelvic floor musculature if it's really tight. The final thing is making sure that you're sort of taking care of the rectal area itself, right, the anus. We want to use things like Tux pads or witch hazel, which can help bring down the inflammation. You can use hydrocortisone cream, and there's also some other creams and things that you can use and other things that we can do as far as prescriptions if things are really bad. And then if it becomes really bad, we can also see a colorectal surgeon and have that sort of taken care of as well. But basically the big things are making sure that you're going regularly and that the stool is soft, that you're using relaxation techniques to sort of relax the pelvic floor musculature to be able to have a bowel movement, and then using things that help soothe the rectum or the anus itself. So I hope this is helpful. Please follow along where I'm going to be continuing the series for the next couple weeks to months. I also am offering a free postpartum planning workshop in July 10th. So you can go to the link in the bio and sign up for that. It's sort of all things to prepare for postpartum. That's what I talk to my patients about regularly to prepare for the postpartum. This is an easy way to at least start getting that conversation going and getting those thoughts going. As always, your job today is keep those little ones alive. All the best. We'll take care. We'll see you soon.